Questions without notice. I call Mrs Morris.
Thank you, Mr Speaker. My question is to the Minister for Health. Local businesses and constituents have expressed concerns about used syringes being dumped in public areas, including parks and playgrounds. Minister, what are some of the health risks associated with being accidentally jabbed by a used syringe?
Minister for Health.
Well, I am a Minister for Health, but I am not a clinician or a public health, qualified specialist. So I think my response to Mrs Morris would be probably in the line of Google it. You'll get as good an answer in terms of the health risks from that as you would from me Googling it and answering your question in relation to the health risks. If what Mrs Morris is concerned about is in fact a matter of littering and syringes being in public places, the responsibility for that doesn't sit with the Health Minister.
Supplementary, Mrs Morris.
And I take it from your answer that you've just given, the answer would be no, but Minister, are you concerned at the health risk discarded syringes presents to young children and families playing in public areas where there are discarded syringes?
I do feel like this is very much asking for an expression of opinion, Mr Speaker, but of course, like any member of the community, I am concerned when I hear about syringes being discarded in public places. And as a local member, I've had those conversations with people in my community as well.
Supplementary, Ms Castley.
Thank you, Mr Speaker. Minister, has the number of syringes dumped in public places increased since your government decriminalised hard drugs like heroin, ice and cocaine?
Ms Chain.
Well, that definitely is a question for me. No, I don't believe so, Mr Speaker. I am happy to take that on notice. What I would say is that needles and sharps of any kind should be reported to Access Canberra on 13 2281 or via the website. There are response times for picking those up. I think it's 2 hours or something like that. It's very short. So that any harm that's possible to the community is rectified. There are also numerous syringe disposal bins right around the city, including within our public health facilities. And I would note that there are many reasons that someone might be using a syringe. It could be Ozempic or Wegovy. That's me. It could be diabetes. It could be anything. Suggesting that there is an inherent immediate risk relating to drug use is not appropriate. I don't believe it's appropriate. And I would say stirring up a sentiment that there is a risk when there is a very clear way of reporting this and getting city services to attend to any issue that someone sees, whether it's in a playground or whatever it may be. That's where I would be focusing Mrs Morris and Ms Castley's efforts.